But topping the news at 5:30, COVID may be on the rise again. Data from the CDC shows there were 7,100 COVID hospitalizations from July 9th to the 15th, and that's a 10% jump from the week before. That's across the country. In the ER, 0.73% of visitors had COVID-19. That's a small number, but it was up 50% from the month before. So joining me now, we welcome Dr. Tom Russo, an expert in the infectious diseases at UB Jacobs School of Medicine. Dr. Russo, we thank you for being here. We've talked to you so often during the pandemic over Zoom, but we haven't had you back in the studio for years, really.
Yeah, it's great to be back.
Thank you.
Thanks for having me, Jackie.
We appreciate you coming in. So let's talk about this. COVID cases are said to be on the rise across the country. Are you seeing that, and are you seeing it locally?
So our national data is our best data, and we are certainly seeing a rise in cases, emergency room visits, and hospitalizations. The greatest increases that we've seen are in the South and the Northeast. We're seeing similar but less pronounced increases in New York State, but that's statewide data. We have more limited data in Erie County, which suggests that we're having increases, but not as pronounced as elsewhere in the country, at least at this time.
Okay, so that's good news for us. But how are these cases being reported now? It's a lot different than during the pandemic. People aren't necessarily reporting to their local health departments anymore. How do you know? Is it wastewater that you're checking, or how do you know if cases are rising?
So tracking cases has been more challenging. Most people are on testing or they're home testing, which is not reported. PCR tests are way down. So for numbers of cases, wastewater or trends in wastewater is one indication. And wastewater measurements of the virus that causes COVID has been up over the last several weeks. But also the increased emergency room visits and hospitalizations also suggest we're having increasing cases, or otherwise people wouldn't be showing up at those venues.
Okay, and then why do you think cases are on the rise?
Well, I think there's three main reasons. First, our behavior. We're gathering and traveling pre-pandemic mode, so there's lots of personal interactions. Secondly, our immunity from either vaccination or prior infection wanes over time, and we're ways off from our most recent booster. Another one should be coming in the next 30 to 60 days. And perhaps the most important driver is heat. Lots of parts of this country have been extraordinarily hot. It's driving people indoors, and that's where the virus spreads best.
That's a good point. I didn't think about that. But now back on vaccinations, you mentioned. What is happening with vaccinations? How long do they last? And it seems to me a lot of people may be due for a vaccine. And should we think about it like the flu vaccine that we get every fall? Are we just in that mode now?
I think we are. I think we're looking at getting a COVID booster at least annually, particularly for those individuals that are at greatest risk of developing severe disease and hospitalizations. Our vaccines are imperfect against preventing infection, so it's better than not getting vaccinated, but we still see some infections. But it's really been quite good in preventing hospitalizations and death, which I think we could agree is the most important thing that we'd like to prevent.
Looking back, and I know this is a very big question, but looking back, we lost more than 1 million Americans during the pandemic. This is your field. What did we as a country do right or wrong?
Well, I think the thing that we did extraordinarily well is developing a vaccine so rapidly. That saved countless lives in this country and around the globe. So really, that is one very positive thing. The other very positive thing is we now have a very good treatment, Paxlovid being the best example. If you are infected with COVID and you're at high risk for developing severe disease, if you start that early, you'll significantly decrease the likelihood of landing in hospital. So those are two really bright spots that have occurred.
Were masks effective?
Oh, there's no question that masks are effective if you use high-quality masks and they fit properly and you actually wear them. So those individuals, and even now I suggest if you're, our seniors with underlying diseases, the most frail or immunocompromised, where immunity may be less than optimal, if you are in a high-risk setting, wearing a mask is probably a good idea right now with this increasing number of cases.
Okay, doctor, very quickly, finally, I do want to ask you this. Do you think we are prepared for the next pandemic?
Well, I think we are certainly much better prepared for the next pandemic, whenever that may occur. And I think that has to do in large part that we've now got detection systems in place, and vaccine development is going to be much more expedient than it was ever before.
All right, Dr. Thomas Russo, don't stay away so long. We'd like to have you back, more often here. It's great to see you.
Well, I'm not sure. When I'm here, maybe that means things are going a little sideways with COVID, so maybe you want to see less of me, Jackie.
No. Always happy to see you. Thank you so much for coming in, Doctor.
Well, thanks for having me.